Hello, everyone, and I want to thank you for joining us. And we have a very special guest with us today, my dear friend, Dr. Lisa Jango. Dr. Lisa Jango, thank you
Thank
for.
you for having me, Dr.
All
Curtis.
right. So, Dr. Lisa Jango is a PA and a naturopath, and she's tell us more about her history. I know she started off in doing cardiovascular surgery as a
Yes.
PA, and then she came back to naturopath. So can you kind of tell us, like, I mean, that's like a whoa, like that's like a whoa, like real big change. Can
It
you?
certainly is. It certainly is. Well, you and I have similar backgrounds in some ways, we're both PAs, we're both naturopaths, but I was in heart surgery and I had a great time there. I was the chief PA. But, when people got on our table in the operating room, they really needed to be there. But I always felt like, well, that disease started decades before. And yes, we're helping them survive, but are we really healing them? And I grew up in a family that, was first generation Italian, first generation Swedish, European. And so the way I was raised, nutrition and lifestyle were very different from your standard American diet that we now have. So I just kind of was wondering, like, if I'm really going to help heal people, we have to start this well before they wind up on this table. And so naturopathic medicine was kind of the way I was living my life personally.
Wow.
But I was, and yes, we were helping the patient in the operating room, but I love medicine. And so we really want to help people heal. And how do we do that? And we had to start well before that. And that's kind of how I got into naturopathic medicine.
Okay. That's interesting because did you see people like eat, come off the table and go to McDonald's like at their follow up?
Well, that wasn't even addressed, actually. They usually after surgery, you're telling them eat whatever you want because, it's a big hit to have surgery and they have to be nutritionally, you need to get a lot of protein and, nutrition in hospitals is not, and I'm talking back then, is not the same as you and I know nutrition. Okay. And I think that's probably one of the biggest problems with, when we talk about health is the information of nutrition out there is even confusing to me because you can't have fat, you can't have this, we demonize foods, that kind of thing. So, no, I mean, actually, most people, when I was in the operating room, they had normal to low cholesterols.
Mm.
Okay. So when you think about, the standard thing is, okay, it's what you eat. Well, yes and no. There's more to it.
Well, you bring up a very good point. So, because everybody wants to come in and say, what diet should I be on? What should I follow? Keto, paleo, elimination diet. So can you help us out on there? And you said something that was key. And I really want to lean in on this one. You said it's more to it than that.
Yes.
Explain.
Okay. So everybody thinks the cause of heart disease is cholesterol.
Okay.
It's the real cause is inflammation. Okay.
Whoa.
All right. Now,
Inflammation. Okay.
yes. Now, all chronic diseases pretty much are caused by low grade inflammation. Okay, somewhere. So we think of inflammation like you sprain your ankle, that kind of thing. But we have many other kinds of inflammation. Bad food, the standard American diet that everybody eats, the McDonald's, like you talked about, drinking, stress, the way we run our lives, many, many things, okay, can cause this low grade inflammation. So people say, well, oh, my cholesterol, I can't have this, I can't have that. No, cholesterol is a molecule that we need. God didn't put it there, so we can demonize it and not have it. Okay. Cholesterol is a molecule that we use for all our hormones. Okay. It's the base molecule for our sex hormones, testosterone, estrogens, things like that. It's the thing that we use to keep our cell membranes fluid, our vessels fluid. But when it gets rusty, okay, or oxidized, that's when cholesterol becomes a problem. And why does it get that way? Because we have inflammation in the body. So
Hmm.
I could go on
Right.
a little tour on that one, but that's
Yeah.
the base, that's the real cause. So you really want to get control of your inflammation. So yes, how you eat makes a difference, but it's probably not when people come to me, I think they'd be a little surprised at how I'm telling them to eat.
Okay. So the moral of the story is don't get rusty.
Don't
That
get
gets you
rusty.
inflammation. Don't let your pipes get rusty.
That's
Okay.
true. That's true.
So you brought up another pivotal point here that said that your cholesterol is really the building blocks for your hormones. So I know that your program is really focused on perimenopausal and menopausal women. Is that the key element there with the cholesterol? Can you expound on that, how that is related?
Absolutely. Yes. So yes, it's one of the premier things is as women age. Now, when we think of heart disease, generally we think it's more of a male issue, but women, and that yes is true at certain ages, okay, but when women start to go through perimenopause and then go through menopause, they lose estrogen. Their estrogen decreases, and that estrogen is very protective of many things, osteoporosis and muscle, things like that, and heart disease. So when women lose that protection, we become more inflamed and we seem to have our risk goes up. The problem with this is most people don't realize that the number one killer of women is heart disease, not cancer. Most people would say breast cancer or something like that, but it really is, and it's under recognized.
So you're telling me when I go through menopause and perimenopausal, I'm doomed, right? Okay.
No, no.
All right.
I'm telling you to pay more attention. That's
All
all.
right. Okay. All right. I was getting ready to wonder. I was having one there. So you you said how can a woman maximize those risk factors perimenopausal and postmenopausal?
Okay, so the main thing is, um, and I probably should have brought this up before, is that women the problem is women don't present the same way with heart disease as men do. Okay. You get that classic, shortness of breath, pain down the left arm, maybe a little indigestion, that kind of, or actual chest pain. That's very typical. Women don't present that way. Okay. They are going to have um, more like feelings of doom. Um, they could be kind of short of breath, but um, it's it's very nebulous. I don't know how to describe it. Um, a little weight, everybody has weight gain. When you become perimenopausal, menopausal, you're gaining your weight around the middle, which isn't great. That causes more inflammation because central obesity or weight around your gut is more metabolically active. But they're more at risk because we don't present. They may get anxious. They may not feel, they feel depressed or impending doom. And we're told it's all in our head, right?
So they
So
give you an SSRI and
yeah,
tell
they
it you're
give you an
depressed. Okay.
SSRI, you're depressed, that kind of thing. Now, and part of it is us, as women, we're going to be like, okay, well, I'm going through menopause. This is normal, but it may not be normal. Okay. And you really have to, your cholesterol will start going up. Okay. You're going to get achy joints, that kind of thing. And it's not that there's a problem with your joints, but your inflammation is rising. So we just say to ourselves, okay, well, I'm getting old. So when I get up in the morning, I'm a little more creaky, or I hurt, or my back hurts, or my hips hurt, or my joints hurt, things like that. Well, to me, those are all clues that, hey, you're starting to get rusty. So, you know,
Don't get rusty now, y'all.
they don't know you can't get rusty. So the thing is that I would take these as clues. So for my patients, that's an important thing because I want to dig deep. So most doctors, what they'll do is they'll just do your regular cholesterol panel and they'll total cholesterol, your good and your bad cholesterol, which there's no such thing. They both can be good, they both can be bad. So your good being HDL, your bad being LDL. But I look under the hood and I look and see how rusty they are, which most doctors don't. Okay. A lot of women, they come to me, they don't want to go on statins. I don't blame them, but you can take care of that rustiness without a statin.
Wait a minute, did y'all hear that? She gonna look up under your hood and make sure y'all not rusty. Okay. And what other doctor is gonna do that? All right. So, Dr. Django, one of the things that you said was as the hormones go down, the inflammation goes up.
Yes.
That would be safe to say, correct?
Yes. Yeah.
So, what are three things that women can do to kind of either slow the progression down or for preventive? So, what are three things that they can do to help with that?
Okay. So one of the things is that, you know, as you know, the gut is all important and is the central thing of your health in general. And your gut microbiome or the bugs in your gut change when your hormones change. Okay? So you need to improve your gut, and it's good to get on a gut restoration type program, an elimination diet. Sometimes as we get older, oh, such and such doesn't agree with me anymore. Well, that could be signs of a leaky gut. So first thing, absolutely repair the gut. They could, that's the one of the biggest things that I do in my program. Um, the next thing is hormone wise. Um, when you fix your gut, your hormones might get better, a little better, but also you want to get in an exercise regime. Now, I'm not talking you have to run miles or whatever. I'm not saying like that, but maintaining your muscle mass is really good. So a little weightlifting would be great. There's certain things that you can eat to optimize your hormones. Okay, there's something called the seed protocol, and that's using seeds with essential fatty acids to help balance you out, even as you're going through menopause, to balance you out. You can consider hormone replacement. That's not something that I do. And you can eat well. And what I mean is eat simply, eat real food. Don't eat refined foods like packaged things. Kind of meat, vegetables. I know everybody thinks meat is bad. It's not. So get your macros right. Eat real food.
That's great. I always tell my patients if you eat out of a bag or a box, you're going to end up in a bag in a box.
I like that. I like that. I like that. So
Yes. So that is really great, Dr. Lisa. And I know you have a program that's out. So the Heartwell 90-day health transformation. So um, I assume, just from what you've told me, you can correct me with that, You're going to assess the leaky pipe. I mean, you're going to assess the rusty pipes. You're
Yes,
going to find out if you're leaky, and
yes,
you're going to unrust the pipes and stop the leak.
yes.
And you can live happily after, right?
Yeah, and then
Okay.
stress, I didn't mention stress is a huge one. So this program is specifically for women, mainly because nobody's really paying attention. And we're not paying attention because we're busy healing, helping everybody else. And we're busy
Mm,
women. So the first, it addresses stress, it addresses all those things that you said, and mindset of putting ourselves first. You know
mm.
how they say when you know in the airplane, you know, they go through the thing, you got to put on your oxygen mask first to help other people. Well, this is kind of the same thing with your heart. Okay. You have to do that because to help your family, you have to be around and you have to be healthy. So,
Wow.
you know, so it's
That's
mine.
mind that's mind blowing, you
Oh,
know.
so, um,
Yeah. So, Dr. Lisa, so how can you told us about your 90-day program. How can we get in contact with you?
well, I am taking, I'm starting like a beta test on the program and we'll be launching it soon. And they can contact me on Instagram at Dr. Lisa Gengo. That's DrLisaGengo. Or they can go to my website, drgengo.com, or they can call my office at 203 434 9143. And we're looking for participants. It's going to be a small cohort to, go through the program. You'll be seeing me, you'll have health coaches, you're going to get a specified exercise program for women. I didn't go into this, but women are very different from men. We don't have to go power lift or don't go do CrossFit to get better. We're very sensitive beings and stress management techniques.
Well, thank you, Dr. Lisa. So if you guys hit that follow button, follow Lisa. If you want to having some heart issues or don't even know what they are, if you're rusty and you're leaky and you're looking for a solution and you got to put the mask on first, de-stress, hey, Dr. Lisa Jango is the place for you, doctor for you, and her Heart Well 90-day health transformation will transform your life. Thank you, Dr. Jango.
Thank you, Dr. Curtis. It was a pleasure talking with you today. All right.